often misperceptions of what integrative medicine is or our approach. And integrative medicine isn't this thing where we completely throw off conventional medicine. We are actually incorporating traditional medicine with integrative therapy. So things like your nutrition, are you seeing a chiropractor or an acupuncturist? How is your sleep? How is your mental health, your spirituality? That is actually the integrative model and the holistic model. It is not an anti-medicine model. It is utilizing all of the aspects that are available to patients these days and acknowledging that it's a part of their care. Which modern medicine and what we see as traditional medicine is not doing because of the type of model that they practice in. One of the things that we really support here is utilizing evidence and creating the relationship between you and your provider so that you make the best decision for your family. And that is a big difference here. We are guided by what's called a clinical practice guideline or recommendations from larger bodies that maybe support a certain specialty. And what we do is we understand those thoroughly, but we also listen to what you have going on for you and what is going on for your family, and we help you make the best decision for you or for your child or for your entire family. And whatever that is really your choice. And that's the concept of medical informed choice, is that we allow you the freedom to make your own choices. I think a great example of our integrative approach is a mom who has just had a new baby. And so we see babies as soon as they're out of the hospital, what we call fresh out of the oven. It's the less than 8-day-old visit. We see the baby, we check in on them. We do an assessment on mom and dad to see how they're coping. And then we see baby regularly after that. And then mom may follow up with her midwife or the person who helped deliver her baby at the 6-week mark or the 3-month mark, but then their care is done there. So they can actually come to our practice, and then we start seeing mom for all of her postpartum needs and her wellness and preventative needs. And then us as the providers in the background, we're helping coordinate this care. We are collaborating with everybody in our practice to get you what you need. If we don't offer it, we have multiple resources, or we incorporate what you're using. So if you have a chiropractor, we can work with them. If you don't have one, we'll give you our recommendations for the area and based on what you're looking for. This approach, I think, is what really sets us apart from other places in the community, because we are here to take care of you and your family for life. My hope is that I'm seeing patients right now, and it gives me the goosebumps right now as I'm talking about it, that I will eventually see their babies as they are babies right now, and I am seeing them. And I think that goal and that legacy that we are creating here of taking care of families and this journey that we call health and wellness and your journey to healing and health, that is what we offer here.